Today we are going to talk about knee pain, which is a very common complaint after certain age, but even in small age groups we are finding knee pain as a common complaint. So why knee pain occurs, what are the cause and what are the stages, and is there a permanent solution in this? So what modern medicine has to offer and what traditional medicine has to offer. Today we'll have a brief awareness on this subject. So usually this kind of lubrication which will give cushioning to your joints. So this cushion will get damaged. The lubrication in between the joints will get damaged, and or this bone might get damaged and form osteophytes. The loose bodies of your bone, which might be disrupting internal lubrication and all. So most of the conditions might be happening in the age, the aging process. You can say osteoporosis or arthritis like that, maybe around 50-60 age. Most of them feel these arthritis pains. But why we are seeing these pains in the younger generation? There must be some strong reason behind it. So there must be some uric acid issues, where if your kidney is not functioning properly, if it is unable to expel through urination, the uric acid gets collected in your knee joints or your other joints, so which must be damaging the lubrication as well as the bone. So which is a very common issue. Why knee pains occur even in the aging process. These are the major complaint. I can say around 70 to 80% people suffer with this kind of issue, whereas 10 to 20% people suffer from rheumatism factor. This is another bigger issue. It is an autoimmune condition where your immune system is attacking your joints. So usually these kind of conditions, you will be consulting a rheumatologist, where he'll be advising lot of steroids just to control your immunity, so that it could stop damaging or control the damaging process. But the damaging process will continue, and all your joints, even the minor joints get bent, and even your knee joints will completely collapse. In modern medicine, the treatment methodology, I can say, if you are in second stage, you will be first stage. No one will care, because most of us are in first stage only. No one is in perfect condition. Everyone's knee joint, there is some issue. In second stage, you might notice some discomfort when you are walking long distances. You might notice few small disturbances in your knee joint. So mostly even in second stage, we might not care that much. But if you are health conscious, you will be visiting a doctor, or you will be taking some kind of painkiller for 1 or 2 days, or you will be using some hot compress or something, and you will take rest, and you are back to your work. Whereas in third stage, there must be some regular nagging pain when you are walking little bit longer distances, or little bit stress and strain will cause some pains. So in third stage, mostly you will be noticing more issues. So you will be regularly taking some kind of painkillers or steroids. You are like medically dependent. But gradually in fourth stage, you are over dependent, and you will be adding more rehabilitation treatments, like just to manage pain. You will be adding physiotherapy and so many other things. And in fourth to fifth stage, you will be ready for surgeries. And this is also not for prevention or curing the problem. It's a surgical management. You are just managing the condition in the joint just to ease the pain. Understand? So it is just like if you are having hunger, you are just controlling hunger, but you are not fulfilling the condition, or you are not coming out of the condition. Whereas in traditional medicine, we'll get into the whatever stage you are, you can visit traditional medicine. WHO is strongly supporting traditional medicine for such kind of lifestyle conditions, because there is no any kind of virus or bacteria involved. If it is a rheumatism problem, it is due to your defective immunity, or if it is an arthritis condition or gout arthritis condition, it is due to a functional defects due to your diet, lifestyle and stress related. So we will identify the exact cause which is causing the damage. So we'll correct your diet, lifestyle, and we'll suggest you some kind of functional herbal medicines which will correct the underlying condition. If there is a problem with your kidney, we'll correct the kidney health, so that further damage will be completely controlled. If you are having a defect in your immune system, we'll correct your immune system with immunomodulation therapy, so that the damaging process will be completely stopped, and whatever damage has occurred, we'll try to improve the lubrication part or the bone health will be corrected, the osteophytes, the osteopenia, all these conditions non-surgically with the help of acupuncture and other regenerative treatments like stem cell therapy and all. So we will regenerate your knee joint, lubrication and all, so that at least 1 or 2 stages will be reversed, so that you are not medically dependent, you are completely out of your condition, and whatever the health you have regained, that will be lasting for your entire life. And we'll also teach you all the self-healthcare techniques, so that again this system, this damage won't occur in your lifetime. So obviously follow traditional medicine, follow acupuncture treatment. This is the best solution. We have cured around thousands of patients in this condition, suffering from knee joint arthritis with rheumatism or uric acid or any other inflammatory condition. So we have a permanent solution. Maximum you have to avoid surgeries, because there is a strong antibiotic resistance. For any minor surgery also you need to take antibiotics, which is killing much more. Because due to antibiotic resistance, infections are killing. So even though your surgeon is very, very skilled, even though your surgery is successful, but due to infections, lot of people are dying. And almost 50% success rate is not good. You can say you can't even fold your leg. So lifelong you will be suffering with the surgical issues. So better go for traditional medicine, opt acupuncture as a first solution, first attempt, because thousands of years we have been dealing with this situation with traditional medicine. You have to adopt traditional medicine, you have to adopt acupuncture, and prevention is always better than cure. You have to get awareness that you have to come in early stages. Instead of taking painkillers or any other management treatment, go for preventive treatment and curative treatment instead of just managing and shutting down the symptoms. So treating the symptoms is never the solution. You have to get into the cause and you have to clear the issue. So understand, your body is crying for help. The pain is the cry for help. So you have to clear the root cause to cure it completely. So don't just manage the symptoms or cover up the symptoms.